Hello viewers, I am Dr. Saurabh Mishra. Today I am going to discuss about urinary stones. This is the most hot topic of urology. It affects mostly the young people who are actually in productive age group, and the financial loss is quite high for any country regarding this condition. Basically, every stone for practical purposes forms in the kidney, and finally once they drop down in the ureter, then they start creating problem. There are stones in the kidneys also, but many of these stones may actually not cause any problem in the kidneys, because the kidney is very large organ, say 120 millimeter of the length compared to a stone. So suppose there is a 5 millimeter, 6 millimeter stone lying down one corner of a kidney of 120 centimeter length. So nothing is going to happen unless this stone erodes the mucosa, or it starts infecting the urine. But once the stone changes its position and it comes from the kidney to the ureter. Ureter is a very thin tube with diameter of 3 mm. So once the stone comes in the ureter, then they have the biggest impact. Suddenly, by just changing the position, they actually choke the whole kidney. So most of the time the patient presents with a severe pain. If you see, the common presentation is usually starts from the month of March, April, or till the September, or say somewhere October. So this is the most hot weather over there, and along with that there is high humidity also, leading to system dehydration. And if you see, these patients usually come to the emergency department for pain, and the pain is really very severe. The pain is so much so that most of the time the oral painkiller, they don't work, and the patient has to land up in the emergency department of the hospital. So under such circumstances, first the patient should be stabilized for the emergency pain, and after making him pain free, the evaluation should be done. Commonest type of patient is usually with a small stone impacted in the ureter. So, and the CT scan is the commonest investigation in most of the standard EDs of good hospitals. So, after doing CT scan, you know the exact location, exact size of the patient. If the size of the stone is less than 5 millimeter, you try to give say observation period of 14 days with some fluid therapy and painkillers, in hope that that can pass spontaneously without damaging the kidney. This 14-day time frame is very important, because the damage is reversible if it is within 14 days. But after 14 days, the kidney, the amount of damage has happened, nothing is recoverable. So, but if the size of the stone is more than 5 mm, and especially the stone is present in the upper ureter, etc. So these are the patient who should be counseled for the surgical intervention. There is a myth in our community, and it's a very dangerous myth, that these stones pass spontaneously. This is just half true. Stone passes spontaneously. In fact, majority of the stone, even big stone, pass spontaneously, but by damaging the kidney. So that aspect no one is aware of, especially the laymen. They just look for the how the stone has passed, and because they are so much scared about this surgical intervention, they lose their kidney without even realizing that a simple endoscopic procedure would have relieved them of this problem. But this is really unfortunate. I will suggest my patients to be more vigilant and go through the details before deciding or before getting scared about the surgery and losing their kidney function. Thank you.